Good morning, good afternoon, everyone. My name is Dmitry Verednichin, and welcome to our Open Canada seminars, which will lead every Wednesday and Friday noon. So, as always, we have two streams here. One is in Zoom, where people could interact with me live, and they see questions and comments and greetings from different places. And another stream is happening in Facebook. In Facebook live, there you will not be able to interact with me live, but you can still ask questions there in comments. And of course, the video recordings will be also uploaded to YouTube and discussed on Substack newsletters and Twitter. So all of you are very welcome to comment, provide your ideas there. It's a great pleasure to be interacting with you and try to find answers to all your questions or comments. So, okay, indeed, I got all the powers back in Ottawa, so thanks for checking on that. And we have a lot of data, we have lots of things. So I will start with our website, which you see on your screen right now. Oh, I need to start sharing my screen. Sorry about that. On my other. Okay. Let me share my screen so that people on Zoom could follow me as well. Okay, and please just let me know if there is any problem with the sound or video. So, okay, excellent. So people who don't know how to access Zoom, the link is right here on the screen. We could go to weekly seminars. And also, very importantly, we have created this Open Canada portal. So I will open it right now. You would see I'm opening it right now. And there I will be providing updates on our agenda, because every week we have a new agenda, right? So we go straight into seminars here. Okay, and here you go. You would see the agenda for this week. All right. So tomorrow we have Ontario elections, and we'll again remind everyone, please exercise your democratic right to vote, but also your human right to think and to be free. So, and we'll talk about that. Now we will look into the updates from Public Health Agency of Canada, which normally are posted on Tuesday evening or Wednesday morning, but as of this morning, 9 o'clock, they have not updated them yet. So we will do it live with you. Now we will look into the questions which were posed by the audience through the chat and through direct communication with me. And the question is, okay, who are these not protected yet individuals who are listed in Table 2 of Public Health Agency of Canada update? And where they are counted? Are they counted as vaccinated or not vaccinated? Right? Because we're always talking about this raison d'etre, or pourquoi, why we're vaccinating someone, we're injecting something into somebody's body in effort to improve the situation. And it does improve in certain situations. In some situations it improves more, in some situations it maybe improves less, right? So that's what is important to understand, of course. And another very interesting discussion is happening right now from Sheldon Yakubchuk. We mentioned his name last time. He has a Twitter post dedicated right now to comorbidities of COVID, right? So, and we will look into that this week. It may not happen today, but just this week. And there was lots of interest about this disappearance of this mysterious spike of excess deaths among young people under 45 years of age in New Brunswick. We dedicated a couple of episodes on that, where we have shown that the number of deaths among this category of young people have increased from 5 people per week to about 20 or even 25 per week as of the latest data they were reporting, which is November last year. Okay, so now what we will do right now, I would like to open with you at the same time the spreadsheet, which is a spreadsheet which generates all these plots. So all these plots are generated automatically. Remember, in the last time we have updated for this, which was the 8th of May, and we would like to see what is happening since then, right? So we will go to that spreadsheet, and spreadsheet is right here. We will click with you right here. We'll open it in a separate tab, and at the same time, I will also open Substack newsletter in a new tab. I will also open new page which we have now created, which is dedicated to helping people to file grievances against the government of Canada following the release of group policy grievances by the union. And we'll go through all of that one item at a time. Now, right now, we already see that full data spreadsheet is open. Okay, so that's where this line currently is empty. We have not put anything there yet, because again, as of 9 o'clock, this data was not published yet. So this is the data of cases following vaccination. It's called table 2. Table 2 of that link, which is right here. And we will click on this link in here, and we will just go there with you directly right now. So I'm opening this spreadsheet, and we will just go there with you, and you can follow with me at the same time. You see, we will check whether they have published maybe in the last couple of hours something, and if they did, we will just update these numbers with you live together. So yes, you see that, okay, it's updated June the 1st. Okay, now where is my beautiful pen? Okay, right here. So we will look into the June 1st update. We will go straight into the cases following vaccination in here. And we scroll down to table number 2, and we see as of May 8th. So it still shows as of May 8th. Now, this is the same May 8th of May, which was reported on the 24th of May. So you see 8 days have passed, and they have not yet provided new updates on those numbers. So again, just to make sure everyone understands what we're doing, we're always taking these numbers shown right here in number of deaths, among unvaccinated, among fully vaccinated with additional dose, and we just put these numbers into that table. And then we see also there is a category called cases not yet protected. So what are these numbers, and how are they counted? So essentially, that was the question which actually several people asked over the last couple of weeks. And this is why we have created a new newsletter article, which is dedicated specifically to this question. Luckily, or of course not luckily, but it's the question which is of interest to many people all over the world. So lots of information has been analyzed, if not in Canada, then in other countries, related to this category of people who are essentially who have received the dose, maybe the second dose, but who are not yet labeled as fully vaccinated, right? So this is why we have published this newsletter. And essentially, it refers to the data which has been updated through the Freedom of Information Act from Europe, from Sweden in particular. And the key message was the following there, that they showed that individuals dying within 2 weeks of vaccination have been classified and counted as unvaccinated. So maybe a more fair approach would be at least to remove them from consideration altogether, but definitely if they are vaccinated. They are vaccinated, maybe there was no time yet for the vaccine to start working, all right? But that, of course, is what we call potentially, or not potentially, this is the fact in Sweden and possibly in other places, that it's another example of using algorithmic bias, what we call, or techniques, which skew the data towards a particular outcome, a particularly desired outcome, right? So, and of course, in this case, it looks like a particular desired outcome was to show that more unvaccinated people die, right? Now, you would ask the question, who desired this outcome? And probably those agencies who are publishing this report. Okay, now another very interesting observation was here that, and of concern as well, is that classification, this classification of unvaccinated was applied to the 14-day period after the second dose as well, not only after the first dose. So we don't know what is the situation in Canada. I looked into the definition of this definition of cases not yet protected, they're called, in official public health agency of Canada, and this is how they define it, and I posted it right on the newsletter. They posted right here. Cases not protected yet from vaccination include those whose episode date occurs less than 14 days after their first dose of vaccine. So that's how they define. Now, I wonder if it occurred after or within 14 days after receiving second dose. I would assume that it probably counts as fully vaccinated to me. That's how it follows from this description. And also, this is probably why these numbers actually, when you look at these numbers, they're quite small. And when you look at these numbers in this table, they're right here. Okay, so full, not protected, not yet protected, right? So you would see that per week, we're talking, in most cases, we're talking just about death cases, just to make it simple. You see that not yet protected, we have 5, 4, and sometimes negative, meaning they overcounted previous week, most likely, right? So that's why we need to average them. But then we have included this new column, not yet protected, as a percentage of total. And you would see, and we put it in the newsletter, that the largest percentage was in the beginning when they started reporting, just before the policy, mandatory policy was released on at the end of, so the data was published, they started publishing in August, as you remember, and the policy was released on the 6th of October. So it's quite a substantial number. So again, indeed, I'm not sure whether this 7% should be added to 9%, like fully vaccinated or partially vaccinated. So again, it's not me to decide, but definitely these numbers should be somehow counted. Now, this leads us to the next question, to the question of grievances, which I have already mentioned. So we have created a page here called self-help. And in here, we have provided information related to various actions, in particular in Canada, related to vaccine mandates. You can click there, and you would see the latest update is that on 19th of May, all unions within public sector filed a grievance, and we talked about that last week. And there was also a National Post article about that. So what we would like to do with you, just we will go into the newsletter, which has been created specifically to examine each clause from these grievances, because this is a very well prepared document, prepared by lawyers who are much better versed in terminology and the rights of Canadians in defending themselves. So what I have done here, I just went to the union page, which is referenced right here, and the grievance is the same for all unions, and it doesn't matter whether you use my union, which is Professional Institute of Public Sector Canada, or another one. And it's just good to go one by one to this policy grievance claims. These are very, very striking on the very clear messages which are there. But let's start from the very beginning. So that's the key message: to keep or place unvaccinated employees on leave without pay beyond April 6 is unjustified and excessive measure in light of the current context. And indeed, we say that the context has changed dramatically since when the policy was developed, and we show it here on the graph. August, September, we had only maybe 10% of fully vaccinated in all cases, even not counting those in interim, in limbo state, which are after dose but within 14 days. We have numbers like 10%, so which is small number. And we already talked about that the way they reported 10 times less than actually what was observed weekly. But now, of course, we're in 8 months later, and we see the numbers have changed quite dramatically. We have 80% of people who are fully vaccinated, and we have a percentage of people of fully vaccinated who are among cases also actually is very comparable to the percentage of fully vaccinated. So the bottom line is here that most countries have already declared pandemic being transitioning to endemic. And there's, when we look at the data, we don't see much evidence that adding extra shots help. In fact, we talked about the fact that they may potentially make it worse. And we will talk about that as well. Right? We talked about the excess deaths happening following vaccination. But again, let's just go back to the grievance. The situation has changed. Unions decided to act, and we thank them very much for that. And now really the new game begins, as hundreds of individual grievances are now actually being poured into their employees. And of course, we're in contact with each other, many people who have been affected, because there is really no legal, no scientific reason to keep these people outside of their work. They can contribute to the well-being of our country here. So the details are right here, and what I would suggest that anyone, even if you are not a federal employee, I do encourage you to go to these claims and just share be compassionate. Let's put it this way: be empathetic to all those people who have been, as we see from this letter, wrongfully, not just convicted wrongfully, but they were the harshest, the most harsh measure was applied to them, which is removing them, suspending not just for 1 day, not for 2 days, not for 5 days, which is happens when people, let's say, steal something or harass someone, something. There would be uh, what's called progressive discipline, from oral reprimand to written reprimand to 1 day suspension to 5 day and so on. This is according to the guidelines of the Treasury Board of Canada. If someone has done something wrong, you apply progressive what is called progressive discipline. So in this case, the harshest measure was applied to all those who should suspend them for the rest of their life, or at least for more than half a year for many of them. So even if you are not one of those people who have been affected, you can just show your empathy and compassion to them, maybe put your comments there in anywhere that maybe indeed you could help those families. Some of them still were not able to find their job, for example, right? So, and pay for their mortgages. And of course, the country is divided right now, and people are angry on those people who are not affected are angry on those who are affected. Sometimes it happens. But again, this is why we come to elections. And when we talk about elections, let me just give you a little segue on that as well. I've been doing training, professional training myself. So I am an expert in biometric technology within the government of Canada. And we do have, as part of our training, we have opportunity to go and attend this professional training where we could get up-to-date knowledge on how to do biometric identification of individuals, just any knowledge which would allow us to do our job better. So within the government of Canada and many other organizations within different parties, they do have their own professional development opportunities. So all those political party members who are there for many years, they've been also, I think, attending those professional development training. And if I go to the conference which deals with biometric technologies or data science, with data technologies, data visualization, now the question for you is, to which those professional development conferences do you think our political leaders went? Okay, they didn't go to the data science conferences. They went probably to conferences specifically designed for professional development of politicians. And what are these conferences? The largest, the most powerful, and the most actually attractive, I would say, because it's also sometimes it's funded, sometimes it's in a good location. It's called World Economic Forum. So all our political party members who've been in this professional business for many years, my belief is from being for 22 years with the government or even more, that they also probably are trained, professional trained as politicians through all those many different professional development opportunities to become a better politician and how to improve the world. Just as I try to improve the biometric technology, data science technology, they also probably got some training on how to do better politics, how to better manage people or improve the world. And this is why I think that most parties, which we call mainstream parties, they have training. They have professional training for many years. For many years, it didn't start with COVID 2 years ago. It started, as we know, this economic forum started from 1971, and many law changes were introduced because of the recommendations from World Economic Forum. So if you want a fresh look, a fresh approach to what is happening in the country, you may wish to vote for a political party which is not a mainstream, which is not liberal, which is not NDP, Neo-Democratic, and which is not green, by the way, because all members of these three main parties have been attending, we know, probably for many years, World Economic Forum as part of their training. So everything which is happening now is according to the World Economic Forum plan, vision, and we know there is a portal called Great Reset. and it talks about how to improve the world, how to save the environment, how to save us from anything they want us to save. Uh, but again, now you do have a choice. If, of course, you are, or if you're still looking for the choices, and you have time and you have desire. But we live in Canada. In Canada, Canada is a beautiful country. I've met so many people right now actually who are helping those affected. It's impressive. I would be most proud to live in the country and live with Canadians like those whom I've been meeting since February in particular. They're going through all those many hardships, and they remain to be not just remain to be. They show their best human qualities, supporting each other, helping each other, even offering each other jobs and products when people cannot earn money for living, right? So now let's go back to our weekly update, and just quickly I will show you a little update on the this not magic, it's this pick, what they call it, the mysterious spike of death, which has been observed here. Right, I'm showing it on the screen. And then you remember, this is Canada just have removed, entirely erased this like boom, and put it not available information. So there was some interest actually from professionals, data professionals and legal professionals, to look more closely, because apparently it's illegal to hide evidence such as this one from public um, domain. So this is why I am preparing now a white paper with full analysis on these incidents, and all cache data from April and now from May, all are posted on GitHub. Any of you can open it in Excel, in Google Sheet, see what has been published in April, see what has been then published in May, see which data has been erased, specifically in age group from 0 to 44. All right, under June, after June 1st. Okay, and you would see the white paper is also being prepared there. So you see a lot of information is being prepared, and on that, I wish everyone again support each other, vote, please, talk to each other, be considerate to each other, because this is a subtle issue. And again, let's understand that vaccine showed to work miraculously for particular portion of population, for particular diseases or variants, but of course it's not the same miraculous maybe treatment for everyone and for every possible variant or disease, and it takes time to tune it, and there are different types of vaccine, and I'm no way expert in this, and this is why there are many experts who are talking about this, and we could dedicate another episode just to provide you with a list of references of medical professionals, professionals in epidemiology, biomedical professionals in Canada and worldwide who have been actively analyzing these using their expertise. Again, I am expert in biometrics or data science, they're experts in something else. And you are expert in your field, but also all of us are human beings and Canadians, and we can help each other. Thank you very much for watching. Please subscribe, please donate whatever amount you want, or just send me email with comments and questions. It always helps. Communications always help. Interaction really energizes me, helps everyone. Let's keep it going. On Friday, I'll see you again at the same time at noon. Cheers.